Hello, world, and welcome to the For Your Best Self podcast. It's Dr. Slujan. Today, I'm proud and pleased to discuss one of my main areas of expertise as a cosmetic dermatologist, aesthetic skin injectables, and this is part 2 of a series of 2 podcasts. This episode is going to cover frequently asked questions, 2021 trends, and some specific techniques such as the Y-lift and MD codes. And then I also want to talk about some treatment areas such as the lips. So let's get right into some frequently asked questions. And I want to address the elephant in the room. Should I get skin fillers if I'm getting the COVID vaccine and vice versa? And this question is based on the news that rarely facial fillers have swelled after vaccination. There were 3 patients in the Moderna vaccine trial that had facial filler swelling. 2 of them had cheek swelling and 1 had lip swelling. The vaccine trial had 30,000 patients, but it is a rare risk. The short answer to that question is absolutely yes to both. Yes, get facial fillers. Yes, get the vaccination. The most common recommendation is to wait 2 weeks between vaccination and filler. But in reality, you can wait and still get temporary swelling. It self-resolves, and that's the good news. If it's significant and you're worried about the swelling lasting for days or weeks, then a short course of steroids such as prednisone or Medrol or antihistamines in conjunction with steroids such as Zyrtec, Claritin, Allegra will most often treat the swelling. So I advise vaccination. I advise fillers. Separate by 2 weeks if possible. If there is swelling, contact your injector, and I'll be happy to help, or your injector will help you. So one question that also pops into mind is how can I prolong the life of my fillers and Botox? It's wearing off, and I want to see, can I make it last longer? So when you exercise, I really want you to try to keep your face relaxed. Make this an intention before you start to work out. Work out the rest of your body, but not your face. So, having a mantra like relax face, relax before you exercise is very helpful. And then you also want to avoid the appearance of fine lines due to dehydration of the skin, as well as sun damage of the skin. So first step, exfoliate. You want to use a vitamin A or tretinoin cream or hydroxy acid cream to exfoliate and stimulate collagen. And then you want to use a hydrator with hyaluronic acid so that your face and lips are hydrated. And that will also help your fillers last longer. Of course, drink water, wear sunglasses when you're outside, and a hat or a visor so you don't squint. The more you squint, you will wear out your Botox or similar injectable faster. You want to protect the skin from the sun. That's your antioxidants and SPF 30 with zinc or titanium. No smoking, absolutely no smoking. That's the quickest way to age. And then sleep to repair skin. It's most important to get sleep. Patients will ask, should I sleep on my back or my side? It is helpful to sleep on your back. If you're sleeping on your side, getting a silk or satin pillowcase is also beneficial for your skin. So if you can only sleep on your side, whatever helps you get sleep. But if you can sleep on your back, that is helpful. Another question, what are some trends for 2021? First, I think it's really important to embrace minimally invasive treatment. So adding something to your injectable treatment, adding fractionated CO2 laser resurfacing, adding microneedling, adding peels, adding hydrofacials, adding dermaplaning. When you're adding treatments, you get a compounded benefit. So one of our favorite treatments is a combination of a medium depth peel with Botox on the same day, and we call that a Glowtox. We are getting a compounded benefit because we're improving the skin as well as relaxing the muscles. So embrace those minimally invasive treatments. Top filler trends for 2021 include cheek filler that helps under eyes too. Really anything that helps your appearance on video. We call it the zoom face. You're looking at your face in video. You're wondering what can you do to help that or this. And so cheek filler is very common to help under eye the fatigue look under the eyes. Customizing lips is a trend, and customizing lips with fillers and techniques that may involve either hydrating them or plumping them, or a combination. Jawline contouring, including the chin. Both Juvederm Voluma is used in the chin, as well as Restylane Define, and our noses look bigger as we age because our chins and our cheeks tend to recede, and so as well as our jawline. So contouring the chin is a trend. And then treating scars. I think we often are conscious of our scars, and there's a lot of things that we can do to improve scars and fillers. Injecting fillers is one of those things. Speaking of jawline, what can I do to enhance the jawline? And I really love a combination treatment here. You can use neuromodulators such as Dysport or Botox or Jeuveau to help relax the platysmal bands that pull down on the jawline for a little bit of a jawline lift. More robust fillers such as Juvederm Voluma, Restylane Lift, or Radiesse can help build up the jawline so that it elongates and has more definition. And then fat dissolver Kybella on the undersurface of the jawline can decrease any extra fat to give it the jawline more shape or definition. And then icing on the cake would be radiofrequency microneedling. Our machine is called Virtue, and the radiofrequency heats the skin, so it tightens it. So there's a bit of a firming effect, and then the microneedles help the skin texture and tone. So that would be a full jawline treatment that's minimally invasive. And then as we're talking about Zoom Face, what can I do to help Zoom Face? And I think, people see themselves in different ways on camera. And so I think being easy on yourself and just being kind to yourself is step one. What you're seeing on camera, probably no one else is noticing. But there are things we can do. If you're noticing crow's lines or forehead lines, we can soften those with our neuromodulators. Or neurotoxins, our Xeomin, Jeuveau, Dysport, Botox. And then we talked about the under eye hollows. I often like putting Restylane in that area, or RHA2 to help with that fatigue look, filling nasolabial lines so that they're a little bit softer. And so let's really, I think there's a lot of Zoom Face means different things to different people, or seeing your face in a selfie or a video means different things to different people. And I think a consultation is a great idea when you're on camera more. Lips. Let's take a moment and let's discuss lips. The best lip enhancements or augmentations look natural. So if you're noticing someone's lips have been enhanced, or augmented, that's not the goal. The goal is that someone else may not notice, and just the person themselves notices. Natural is key here, and we've often forgotten what natural looks like. So I'm here to remind you. Our vermilion border, which is the white roll of the lip, shouldn't be tinted. It shouldn't be ledged. It shouldn't have a shelf. So injecting into the border is not ideal. The white roll should be a very subtle part of the lip that just provides a little bit of a definition. But over-exaggerating that is not the goal. We really want to inject the pillows of the lips. The upper lip can have 2 or 3 pillows, and the lower lip has 2 pillows. And these are the medical terms called tubercles. And we want to inject these pillows so that the lips are naturally enhanced. The goal is to be conservative and not always add a full syringe. So often I will take a half a syringe of filler in the lip, and then the other half of the syringe, I'll use it to support the tissue and the folds around the lips, including assessing and treating the chin, because often by treating the chin or the folds, the lips appear enhanced as well. So it's kind of the effect of, if you're going to repaint a door of a house, and you really want to look at the rest of the house and make sure the roof and the windows and the trim match as well. And so with lips, you also want to look at the tissue surrounding the lips. At times, we may need to dissolve lip filler if there are bumps or if there's filler migration. And so the filler over time can often descend, especially if you've had injections over years. The fillers can descend into weaker parts of the lip, such as the lower edge of the upper lip, and you might see bumps or feel bumps on that inner surface of the lower edge of the upper lip. And it's okay to use a medication called hyaluronidase. It's an enzyme that dissolves the hyaluronic acid filler within a day or two, and this helps refine filler, especially if you've been injected, like I said, for years. And so I want to really tell you not to be scared or fearful of hyaluronidase. It's really doesn't get rid of all your filler. It's really used to refine filler. And sometimes a little bit of a restart is really helpful. And that's where that enzyme or that injection helps. And then, lastly, just remember subtlety is the purest form of beauty. So that definitely applies to lips. And sometimes less is more. So we want to enhance, we want to hydrate, we want to improve lines, we want to improve the pillows, but we want to do it in a very subtle way. I want to talk about, speaking of lips and other areas where we're injecting, there is something called the dusky danger, and this is really why we keep the hyaluronidase enzymes in the office, and why you should always get treatment with filler in a medical office, because within a few hours after treatment with filler, if you notice a lighter color in your skin that wasn't there before, the skin looks blanched or dusky, or the skin's painful, or there's a discoloration that is, not a purple bruise, you want to call your injector and let them know. In the meantime, you don't want to ice, because ice restricts blood flow, and we want to increase circulation if there's any filler in the vessel that's creating what's called vascular compromise. So we actually recommend heat and gentle massage in this case, and then coming in to be evaluated promptly. It's very, very rare, but it's important to recognize. So blanched, dusky, pain, that's important to call. So now that we've talked about a couple questions, trends, and a danger to watch for, I want to switch slightly and review my top injectable programs. And those are the Y-Lift, MD Codes, and the Saluja Skin Lift programs. So let me start with the Y-Lift. I started offering the Y-Lift over 2 years ago in the office, and the Y-Lift is based on the notion that youthful facial contours are shaped like the letter Y. So if you were to superimpose a Y over the face, you'd see that it appears wide at the top, and then it spans the eyes and the cheekbone region, and then it narrows to a point culminating in the chin. However, as we age, the upper arms of the Y shape begin to slowly sag downwards, and as the widening occurs, the youthful Y shape of the face begins to disappear, and essentially the face deflates and loses its volume. The effect is that the sort of the lift of the face becomes more sunken, and then the face appears more aged. So we can use the Y-Lift to restore the cheek contours as well as the jawline contours, which is the second Y. Or we can use it to enhance cheekbone and jawline. So when we're assessing for a Y-Lift, those are the two areas we are really looking at, the cheek and the jawline. Do these need enhancement or restoration? So enhancement if you're looking for improvement at any age, and then restoration if you're looking for improvement for an aging face. And I learned this technique from Dr. Jan Trokel, who's a board-certified maxillofacial surgeon specializing in facial cosmetic surgery. And he visited the office and trained me over a number of sessions. I also went to his New York City office a number of times to learn and refine the technique. And it was one of the most exciting additions to the practice, because it really works to restore a youthful face contour. And it's instant. It really accentuates the cheekbone region, revives the under eye area, sharply defines the jawline, and it lifts the neck instantly. And it requires, no incisions, obviously no general anesthesia. It's done in the office with topical anesthesia, and the downtime is very minimal. There's swelling and bruising for up to a week, and it's really a customized enhancement for everyone's unique, for each individual's unique facial features, And what is the Y-Lift? It is injections. It's injections using filler, most often Juvederm Voluma, but also Radiesse or Restylane Lift can be used in a Y-Lift. And we use micro cannulas and needles, and they're inserted between underneath the skin and underneath the muscle, actually. And it helps lift the muscle, the fascia, and the fat underlying the skin, because most of the filler is placed directly over the bone. And that sounds scary and uncomfortable, but the bone is actually an area that's a very safe place to put filler. And you actually get you get the filler to go a far way by having it mimic bone. It looks more natural. The face looks less pillowy, and you get that natural looking enhanced jawline and cheekbone. And so once the filler's placed, we sculpt it to accentuate and highlight those areas. And how do I know whether you're a Y-lift candidate or not? That is really decided through a consultation. How much filler do you need? How do we decide that? That's really decided through a facial injectable mapping consultation. So we'll draw on your face and measure and show you where each syringe of filler would go. And so you'll know ahead of time, like, this is what we're placing where. Then basically topical anesthesia is applied for approximately 30 minutes. Additional relaxing medicine or nitrous oxide can be given if you prefer. The procedure takes about 30 minutes. And post-procedure, we ask you to hold on dental visits for 2 weeks and hold on travel for a few days so that we can see you and make sure that things are looking good. I usually do a 1-week follow-up to check in, and then a 4-week follow-up to do any refinements. There's no preparation required for the procedure except to hold blood thinning medicines and supplements for 1 week prior if possible, and to take famciclovir, acyclovir if you have a history of cold sores or fever blisters starting on the day of the procedure. Arnica tablets can be started 3 days preceding the procedure as well to help with inflammation, tenderness, swelling, bruising. And then you're going to continue all your normally prescribed daily routine in terms of skincare and other medications prior to the procedure if you're on any. If you are going to lose a significant amount of weight, we ask that you hold on doing the Y-lift until you're closer to the weight you want to maintain. If you have an active infection prior to the procedure, you're going to inform us. In this situation, we may also hold on the Y-lift until you're well again. The Y-lift can last between 1 and 3 years, and that varies on the patient's individual metabolism. We all dissolve filler at different rates, and so if somebody has a faster metabolism for filler, we might do a touch-up in 1 year, and other people it might be 2 or 3 years. Cost comes up. What's the price of the Y-lift? The price can range greatly. It's charged by how much product we use to determine your own individual result and which areas you want to focus on. I may have patients that just want to focus on cheekbone. I may have patients that just want to focus on jawline. We may have patients that want to focus on the whole thing. They might want to do, say, focus on cheekbone, jawline, temple. Let's also refine around the mouth. Maybe add the lips. So typically a full Y-lift procedure can range anywhere between $5,000 and up. But some people will have a mini lift, and that might start at $1,500, or somebody may have a mid-face treatment, or they're only treating a certain area, and that might range from $2,000 to $3,000. So it really depends on the number of syringes and how complete of a facial treatment with injectables you'd like to do. Sometimes we can do the full facial mapping with injectables and do a full Y-lift, but split it up over a few visits. So there's definitely options, and it's definitely customizable. I inject the most filler in Central Florida, and what I've learned over the years is that you really have to listen to the patient to see what they want, because there are a lot of people that want one and done for a while, and then there are a lot of people that prefer small amounts, every quarter, and both ways are absolutely acceptable. One of the more recent techniques I've learned is called MD codes, and MD codes really is based on the philosophy that the face is like a house, and that laying the foundation is always the first step for the best results. And in the MD codes, the foundation is the cheekbone. And in that way, it's similar to the Y-lift, and the cheekbone is kind of the area you start to assess. And it's really amazing how interesting it is by enhancing the cheekbone, how we're able to make other areas of the face also improve. These areas are all interconnected, and so improving one area may make the marionette, improving the cheekbone may make the marionette or the nasolabial fold look better. So once we have the foundation improved, the next step is looking at the contour. And that's the framing, the floors, the walls. And so if we're looking at contour, we're starting to really look at chin area, jowl area, and jawline area. So after cheeks, we then look at chin, jawline, jowl, and that's contour. And then last, we look at refinements. And patients will often come and ask for the refinements first. And refinements, if you compare it to a house, is like the interior decor. So we really want to add those last if possible. And that's the nasolabial fold, the marionettes, and the lips. So I will always educate you on lay your foundation first, look at your cheekbone, contour or construct the framing, the floors, the walls, which is your chin, jawline, jowl area, and then refine the interior decor, which is the nasolabial, marionette, and lips. And that way you have the education, but ultimately it's your choice. Sometimes, instant gratification wins out, and we just want to do the lips and the nasolabial folds and get on our way. But by having that education, you can come back and maybe the next visit be ready for talking about cheeks and chin. So ask me about MD codes. And then finally, I want to talk about the Saluja Skin Lift programs. And these are my customized programs that are non-surgical, involve Botox or similar neurotoxin and filler. And I have a gentle lift, and I often use the gentle lift in patients that are under 50 or are in maintenance phase with fillers, and we combine a full face muscle relaxation with our Botox or similar neuromodulator, and then we do fillers. I have a confidence lift, which is usually my patients 50 and up, and that's where we add a bonus syringe of filler along with the neuromodulators or the muscle relaxer, Botox or similar. I have a sculpting lift, and that's where we use Sculptra. And then I have a longevity lift, and that's where we use Bellafill, which is the 5+ year filler. And then I have a chin lift, which is where I use Kybella. And Kybella is an injectable that dissolves fat and helps with jawline contour, especially as some of our fat descends into the submandibular below jawline area, below chin area, and sometimes even in the jowl area. So these are some ways to customize things for you. What's new in the pipeline? So it's interesting. Something I'm really excited about is QWO, Quo. I'm not even sure how to pronounce it yet, but the name of the new medication is called QWO, and it's a non-surgical injectable that will be released this year in 2021 as a treatment for moderate to severe cellulitis in the buttocks of adult women. And this is the first of its kind of injectable. So I really want you to stay tuned as we learn more. So we're really starting to do injectables off the face. For example, in fact, I forgot to tell you that I do Sculptra in a different manner, different dilution, different injection technique to rejuvenate the neck and the chest as well. A lot of my patients complain about crepey neck or kind of a crepey décolleté. And so I use a vial of Sculptra in each area, and we may repeat that in 6 weeks and do a second vial. But it really helps with the texture of the skin. We've done skin above the elbows or above the knees in a similar manner. So we're doing more things off body. Also been using Radiesse for a booty lift for people who want to augment kind of the upper buttock area for a lift. And so we have been doing more injectables off the body. I recommend a consultation on those. And then I'm really kind of looking forward to the newer things in the pipeline, including this new injectable for cellulite, because there hasn't really been a lot of there really is nothing that works very well in our current armamentarium of minimally invasive or of injectables really for buttocks and for cellulite. So that's a wrap. on the For Your Best Self podcast, Skin Injectables Part 2. I'm Dr. Saluja, and it was a pleasure to be with you today. Subscribe to our For Your Best Self podcast on Apple Podcasts, Spotify, or Dr. Saluja, Dr. Nova on YouTube. And until next time.